people are misled about the cost between original Medicare versus Medicare Advantage. So in this video, I want to get really clear on what the costs really are so that you can make an informed decision when you first join Medicare, because we can't always make changes in the future because of Medicare's guarantee issuance rules. I'm Emily with the Medicare Coach. We are an independent Medicare consultant, helping our clients easily navigate Medicare rules and insurance company overwhelm to help them do what's right for them, to both have the best healthcare, the best health insurance, while protecting their retirement savings. So you will hear me say very different things in this video compared to what the insurance person or even what the government's telling you. It's all about getting Medicare right for you, like my dad and I did just a few years ago. Also, in the comment section below, I'll have some extra free resources to help you get a jumpstart on Medicare, to guide you down the right path, and to save you time, save you frustration, make it simple and easy. So when it comes to the costs between original Medicare and Medicare Advantage, I want to talk a bit about what these plans are really identical when it comes to. So no matter if you're on original Medicare or Medicare Advantage, you still have Medicare's basic Part A insurance, which is your hospital insurance, as well as Medicare Part B insurance, your medical insurance. If you're not sure what that is, I'll put a link below to more videos on that, but those are the main parts of Medicare that you have to have no matter which path you go down. Most of you will pay nothing, $0 premium for Medicare Part A premiums, but Medicare Part B premium does have a monthly premium. It can be lower if you qualify for Medicaid or certain extra help programs, but it can also be higher if you have a higher income. The takeaway here is this: no matter if you go on the original Medicare route or Medicare Advantage, these Medicare Part A and B premiums are completely identical, okay? So those costs are exactly the same. Now, if we go on the original Medicare route, you're likely going to have a Medicare Supplement, which is also called a Medigap plan, as well as a Part D drug plan, okay? And if you go on Medicare Advantage, you're gonna have just one Advantage plan. Let's talk about the costs first with those Medicare supplement plans. Now, these have a monthly premium, and depending on the plan that you pick and the state that you live in, you will have different premiums. Some of the cheapest plans in some states are as low as $30 a month. Some of the more expensive states are closer to $300. So those premiums can be different based on, again, which plan you pick and where you live. I think it's important to understand that yes, the premiums can be high, but these plans reduce your total out-of-pocket expenses. So while the premiums are high, they do cover you when you have high health bills. The other thing you'll have in Medicare Part D is your Medicare Part D drug premium. The other thing you have on original Medicare is your Medicare Part D, right? Your prescription drug coverage. These plans can be from $0 a month up to over $100 a month. So yes, there are premiums on Medicare Part D, and there can also be medication copays. So we have premiums on this side. Additional ones are Medigap, as well as Part D drug plans. On Medicare Advantage, we have an Advantage plan. And the Advantage plan's premiums are somewhere between $0 and over $100 a month, okay? They also have copays in that plan, as well as deductibles. So I'm initially talking about premiums, right? Because when people think about costs, they usually go to premiums first. But we all know there's more to health insurance than just a monthly premium, right? We have copays and deductibles and maximum out-of-pockets. I mentioned a bit about the premiums so far. Generally speaking, when you're on Medicare Advantage, you usually have lower monthly premiums. The original Medicare side, where we have a Medigap and a Part D plan, they tend to have higher monthly premiums. So if you're only looking at premiums, which is what most people do when they come to Medicare, that's what usually the ads tell you and the insurance people tell you, people tend to only look at premiums to make their right Medicare decision. And that's usually a big mistake. Now look, if you are healthy and you're never gonna have health issues ever, then probably yes, the lowest premium plan is your best option. But the reality is most of us do have health issues, and we're going to at least see the doctor for a few things, or have a couple of medications filled, even if they're generics. And as soon as we have anything else at play, I think it's really important to look at total costs, okay? I had a client today who came to me who's on this medication, and there is a $3,000 difference between one plan and the other. And so it's really important, these little details that we look at to again ultimately save you money. So when we look at costs, I think why people are misled is they stop at premiums. It's really important to look at deductibles, copays, and max out of pockets. Now, there's no general rule necessarily around copays as well as deductibles, but I want to focus on maximum out of pockets on the two different paths. With Medicare Advantage, they do have a maximum out of pocket for in-network if you're in an HMO, or in-network and out-of-network if you have a PPO, okay? Those in-network limits can be up to $6,000, $8,000 a year. And I've seen Advantage plans that are PPOs have out-of-network limits of over $10,000 a year, which to me is a lot of money. And when people are planning for retirement or are in retirement, they usually can't afford a surprise $10,000 expense. So while Advantage plans have lower premiums, they tend to have higher out-of-pocket costs. Now, people might tell me, well, Emily, the chance of you ever hitting that maximum is slim to none. And I say, you're right, right? I wouldn't say none. I say most people will never hit their maximum out-of-pocket on an Advantage plan. But when people do get that cancer diagnosis and they do hit it, it's not pretty. Usually original Medicare with that Medigap and that Part D plan has lower total out-of-pocket costs than Medicare Advantage, right? Nothing is free. So yes, you pay more premiums on original Medicare, but when you do have those medical costs, they tend to be a lot less expensive. So my key with this video is this: please do not stop on premiums, right? Premiums, yes, they're the same for Medicare Part A and B. They tend to be lower on Advantage than say Supplement and Part D. But when we look at total costs, there are other things to consider. At the Medicare Coach, we want to go through a process to get you the best healthcare, right? 1 is doctors, 2 is usually costs. But please be aware of all the costs involved, because people call me all the time because they have these huge expenses they never expected. And it's because they were never talked about anything about costs besides the premium. So please be informed, do what's right for you, and really understand how the costs work. Because again, how Medicare rules work, we cannot change everything every year. Yes, it is easy to change Part D and Medicare Advantage, but in most states, it's really hard to go back to original Medicare with a Medicare supplement plan. So please be thorough and thoughtful when it comes to Medicare, okay? If you found this video helpful, give me a thumbs up. If you have any questions, comment below. But again, I'm Emily with the Medicare Coach, and here's to helping you easily make your right Medicare decision to protect your healthcare rights and retirement savings.